Good evening, and thank you for inviting me to participate in this important event. In Scotland, we face a national public health emergency. Drug-related deaths are tragic and avoidable, and our national crisis is our national shame. Each person who dies a drug-related death is a fellow citizen, someone's brother, sister, son, daughter, mother or father. And we must do more, do it better and faster to save lives. This is why the Scottish Government have launched a national mission to reduce drug-related deaths and harms. And I'm pleased to say that I have secured additional funding of £250 million over the next 5 years of Parliament to provide that mission with the resources it needs. This includes a £100 million investment in residential rehabilitation too. And I've also allocated an extra £5 million for this financial year, providing additional funding to alcohol and drug partnerships, frontline services and grassroots organisations so they can meet the urgent need in their areas. The priority for the national mission is to embed emergency work to save lives with the work to improve lives, ensuring harm reduction and recovery work is rooted in our work to improve mental health, tackle homelessness, adverse childhood experiences, and address poverty and inequality. We need a culture of change and a culture of compassion to ensure our services are responsive, flexible and person-centred. And I want to ensure every person who needs to can access the treatment that is right for them as quickly as possible. Now this evening you will have the opportunity to hear from people with lived experience, and I can assure you that hearing from those people with both lived and living experience will be at the very heart of our national mission. And I will hear from those people and their families who have received too little too late, and I will hear from parents who are worried sick about that phone call or the knock at the door, and I will hear from those who are in recovery or treatment. And I am determined to find the best way to reach out to those who are currently living with addiction and are not in treatment or engaged with services. It is the job of government at all levels to lead, to have a razor-like focus on implementation and to work with others to make changes as soon as possible. Our response to the global pandemic has demonstrated that rapid change is possible, and there should be no returning to normal where new approaches to care and treatment have worked. As we all know, there is no one solution to the issues surrounding problem substance use. But this is where our courage to debate and deliver what works is crucial, so that we get to a position without delay where there is a range of responsive, quality services and approaches to tackle this emergency head-on. And we must promote the right route to reduce harm and provide recovery for each individual, nothing less than the right treatment at the right time. And our services need to stick with people, and we need to reach out to people wherever they are. And everything we say and do must lead to a better informed debate that knocks down stigma and knocks down the obstacles to change and leads to better life chances for those who most require support. We need to provide dignity, respect, compassion and hope. Thank you very much, and I look forward to hearing about the outcomes of your important event tonight. Thank you.